Hello everyone, today topic is Mukherjee Committee. The Mukherjee, before going to know about the Mukherjee Committee, we have to give a look on the Chadha Committee, because Chadha Committee has given the recommendations that basic health worker, they are known as the multipurpose worker. They will do the work, work just like maintenance phase of the malaria vigilance work, and also the collection of the vital statistics, and also the family planning program. But it is found after a couple of years, or after few years, given by the recommendation of the Chadha Committee, it is found that the basic health, the work of the malaria eradication, the work of the maintenance phase of the malaria eradication program was not done satisfactorily, the result, and the family planning program, the awareness of the family planning program, that is also not achieved. So this is the matter of discussion that was held in the Central Health Council in the year of 1965. So there is a need of one committee who will review the work of the family planning program. So that is the main cause for the formation of this Mukherjee Committee. So the Mukherjee Committee was headed by the Secretary of the Health, Shri Mukherji. That time the Shri Mukherji, he was the Secretary of the Health. So then the main aim of this program is that main aim of this committee was to review the performance in the area of family planning, to carry the family planning program, how the family planning program will be done, or watch out the achievement of the family planning program, or to work the performance of the family planning, the worker involved in the family planning program. So that was the main aim for this Mukherjee Committee. So the propose is that the recommendation of the Chadha Committee, when implemented, when the Chadha Committee program recommendation was implemented, were found to be impracticable. Means the work, how the result was not achieved. The target is not achieved. So achieved because the basic health worker with their multiple functions, because they have multiple functions, they are not only to do the work of the malaria eradication program, they have to do work of the vital collection of vital statistics, they have to educate the people about the family planning program. So could do justice neither the malaria work, neither the malaria work is achieved, that is the progress is seen, nor the family planning work. Family planning also the target is not achieved. So they gave this committee give a recommendations to delink the malaria from the family planning. Means to delink, means separate. They make separate for the family planning and the basic health, the multipurpose worker, those who are doing other work like malaria vigilance work, collection of vital statistics. So they are not do the family planning program. They are not involved in the family planning program. So that the latter receive the undivided attention of the health staff. So they separately do their work and appoint exclusive staff for the family planning, because family planning concept it should be first to be clear to the population, because people, if they are not educated about the family planning, the benefits of the family planning, so they cannot try for the family planning or the sterilization or the IUCD, intrauterine device contraceptives. They cannot try this one. So first I have to educate them about the benefits of the birth spacing, family planning methods, and whatever the new methods are nowadays. So first they have to educate. So for education they need exclusive staffs to clear the concept on the family planning to the people. The staff for family planning, the health assistant to be carried out. So this work are carried out by the health assistant of that area. So this is the recommendation that is given in the year of 1965. After 1 year, there is second recommendation that was given in the year of 1966. So why this second recommendation? Because the state has to play a burden, because state has they have to work the maintenance phase of the malaria. They has to, in that time also some of the program like family planning program, smallpox eradication programs, leprosy, trachoma are continuing, are in progress. So and that time the shortage of fund is the material money, and that will be limited. So the state has the burden to do all this work all together simultaneously. So there is a recommendation, some need to be some change in the health system. So in the second recommendation, appointment of the basic health workers at the rate of 1 per 10,000 population, that is in the rural population, and 1 in 15,000 population, that is in the urban area. That is the recommendation, second recommendation that is given by the Mukherjee Committee. And also the appointment of the one health inspector to supervise the work of 4 basic health workers. So those who are working in 10,000 in rural and 50,000 in the urban, so their work will be supervised by this health inspector. And there is the appointment of health visitors, that is in the 40,000 population, 1 health visitors, who to supervise the work of the 4 NMs. So auxiliary midwives, so their work also supervised by this health visitors who are in the 40,000 population. So these ANMs, basic health workers, so they are given a training about how they about the educations on the family planning. So they can train, they can educate the people of that area, and the counseling them and motivate them for to take the contraceptive methods, and they are also given an incentives who if they have given counsel a couple for vasectomy or tubectomy, so they have given an incentive also. And there is also some money also given as a honorarium who have done the contraceptives, who has motivate the people for the contraceptives to use for the birth spacing or the family planning methods. So that is also created, that is also in the second recommendation, provide incentives those who the workers, just like ANMs, basic health worker, who will motivate the couple for the vasectomy and the tubectomy, and the acceptor of the contraceptives and the sterilization. Establish strong administrative machinery. So there is an administrative machinery should be done, because family planning program is a center sponsored program, because the center first sponsored this program. So this program, how this program will be come to the state level and to the district level. So there is a next machinery, means the how this work will be from the down, go from the center to the down, means block level. So if it is simultaneously go from the center, state and block, then the family planning program will be achieved. So there is an administrative machinery for the center down to the block level. So for the administrative function, there is an emphasis given on the State Family Planning Bureau. So that time, once one of the organization that is called State Family Planning Bureau was done, and it has 2 divisions, that is, one is the administrative work and second is the operational work. So in administrative work, they have plan the budget, how much material will be required, how much contraceptives will be required for the that much of populations. So and how this will be distributed proper to the people. So these are the work, the blueprint, or we say the budgetary work that will be carried out by the administrative persons. And the operational, in the operations, the field workers like doctors are involved to counsel or motivates the people, the couple, for the sterilization process or for the intrauterine contraceptive devices. So that is in 2 ways the State Family Planning Bureau work. Similarly, strengthening of the District Family Planning Bureau, that is also in the district level, the strengthening should be required. So there is, by the 3 division it is carried out. One is the administrative, second one is the educator, and the third one is the operation. Because administrative is the similarly he also make a blueprint, or he also estimate how much contraceptives will be required, how much money will be required for the smoothly maintain of the family planning program. So this is the budgetary work was carried out by the administrative level. and the educator. So the educator is very much required, but the only one thing, education can change our health systems. So that time people are not aware about this family planning. People are not openly spoke about this about the family planning methods. So education is very important. So the educators and the voluntary workers and are the post was created to who go to the people and motivate them to adopt this family planning methods, and what are the benefits of this family planning method, what are the benefits of the birth spacing, that will be encouraged between the people, eligible people, couple. And also the operation. So those who are field, those who are working the field, just like doctors, they are also given incentives and incentives if they have given, they have done the installation process, and also if they have given, they have a counsel couple for the intrauterine contraceptive device, they are also given an honorarium of some money, that also be given. So by this whole work as a team work from the center, state and district, if they are working together, so that can the family planning program will be achieved. So for this, the second recommendation was given in the year of 1966. So the two recommendations, first one in the year of 1965, and it was to delink the work of the basic health worker with the family planning worker. So separately they will work. And the second one is the strengthening of the family planning program. So the state has a much burden, because that time family planning program is continued, and simultaneously smallpox program, leprosy program, trachoma program are also carried out. So it was with the state is being pressured, and then also the funding is very less that time. So there is second recommendations was given by the Srivastava committee, given by this Mukherjee Committee for the smoothly operation of this, smoothly launching of this family planning program. Hope you understand about the Srivastava Committee. Hope you understand about the Mukherjee Committee. Please subscribe my channel. Thank you for watching.